You will draw this picture along with me. This is the zygomatic process. Zygomatic process. This is mandibular fossa. Mandibular fossa. Today's class is Temporomandibular Joint. Temporomandibular Joint. This is the head of the mandible. Head of mandible. This is external auditory meatus. Auditory meatus. This is the styloid process. Styloid process. This is mastoid part. Mastoid part of temporal bone. Right. Now, the characteristic of this joint is that this joint is completely divided by one fibrocartilage that is called articular disc. It completely divides the joint into upper and lower compartment. This upper compartment is known as meniscotemporal compartment. Meniscotemporal, as it is towards the temporal bone. This is the temporal bone, the meniscotemporal compartment. Meniscotemporal compartment. A lower compartment is known as meniscomandibular compartment. Meniscomandibular compartment. Right. What are you talking? Bolo. Stand up. From this picture, you tell me what are the bones that are taking part in the formation of this temporomandibular joint. From this picture, diagram, bro. तुम्हारा तो सामने है, बोलो. This is called head of the mandible. So the head of the mandible, and this part is known as, what is that? Mandibular fossa. Mandibular fossa. So between the mandibular fossa and head of the mandible, these two bones are taking part in the formation of this joint. Sit down. Now, what are the ligaments? Now, after describing the component parts of the joint, and bony compartments, then you have to describe the ligaments that are taking part in the formation of this joint. Number one, in any synovial joint, first you should mention about the capsular ligament. I will draw capsular ligament like this. This is the capsular ligament. Capsular ligament, where it is attached? Anteriorly it is attached to articular tubercle. What is articular tubercle? I think you have completed mandible, so you are well aware of this tubercle. Anterior tubercle, what is that? Anterior tubercle. So anteriorly it is attached to the anterior tubercle, posteriorly attached to the posterior glenoid tubercle, and in between These two tubercle anterior posteriorly. In between it attached to the margin of the mandibular fossa. So this is the attachment of the capsule above, and below here you see it is attached around the neck of the mandible. So this is the attachment of the capsular ligament. Now come to the most important ligament is lateral temporomandibular ligament. It is coming from the it is a zygomatic process, and it is a zygoma. So it is coming from here, and it is attached to the neck of the mandible, right? Now there is another important muscle here that is coming from the anterior aspect, that is lateral pterygoid muscle. That lateral pterygoid muscle coming like this. This lateral pterygoid muscle, this is lateral pterygoid muscle. This lateral pterygoid muscle is attached to capsular ligament as well as is attached to the articular disc. This attachment is very important. You will remember this. Lateral pterygoid muscle is coming from front. It is attached to the capsular ligament as well as it is attached to the articular disc. Articular disc, right? There are two other ligaments that lies medially. They are accessory ligament. There is Sphenomandibular ligament and Stylomandibular ligament. Stylomandibular ligament is coming from where? At the time of discussion of the investing layer of deep cervical fascia, if you remember that deep cervical fascia has somewhere it has condensed to form ligaments. So this is stylomandibular ligament, which is stretching between the lateral surface of the styloid process up to the angle of the mandible. That is called stylomandibular ligament. So stylomandibular ligament is the condensation of the investing layer of deep cervical fascia. In a sphenomandibular ligament, it is embryological remnant. It is coming from the membrane of the second branchial arch. Right? So these are two accessory ligament lies medially. Now after that, come to the I will discuss the relations last of all. First ligaments, then come to the arterial supply and blood supply. Which artery lies in this region? What artery lies there? You have already completed this anterior triangle, and you have completed the branches of the external carotid artery. What are the branches? Last branch of the external carotid artery? Two terminal division. What are they? Last terminal division of external carotid artery. কিছুই পড়ছি ধরে একবারে 3 মাস, only 3 months কবে কমপ্লিট হবে? এখন তো আছে অনেক কিছু বাকি, হেড নেক ব্রেন সব বাকি, তার পেছনগুলো তো এখন পড়তে হবে। How will you complete? Up till now you have not yet memorized the branches of the external carotid artery. Superficial temporal and maxillary. Superficial temporal and maxillary artery, it divides within a gland. What is the name of that gland? Parotid gland. Within parotid gland divides. And you know that just above the parotid gland lies this temporomandibular joint. So these two arteries will supply this joint. So maxillary branches of the maxillary artery as well as superficial temporal artery will supply this joint. It lies between this. It is the posterior border of the mandible. A masseteric process. Here lies the parotid gland, and with this parotid gland lies these branches. So naturally it will supply this joint. Another important nerve lies just behind the superficial temporal artery. What is the name of that nerve? Auriculotemporal nerve. Auriculotemporal nerve. So that auriculotemporal nerve will supply this joint. Another nerve that is lingual nerve. Masseteric nerve. Masseteric nerve also supply this joint. Anterior part by the masseteric nerve and posterior part by the temporomandibular nerve. So these are the nerves. So arterial supply हो गया, nerve supply हो गया. Now movement. What are the movement that take place in this joint? Number one, opening and closing. Closing means elevation. Opening means depression. Depression of the mandible means opening. Closing means elevation. And protraction, retraction. And side to side. Now, I have already told you that it is divided into two compartments, upper compartment and lower compartment. If you cannot remember the name of the upper compartments, just mention upper compartment and lower compartment. What are the movements that take part at the upper compartment? Protraction and retraction. Protraction means forward movement and retraction means backward movement of the jaw. So protraction and retraction as well as chewing, side to side movement will occur at the upper compartment. And lower compartment, that is hinge movement, rotatory movement, hinge movement, lower compartments. So these are the movement that take place at this joint. Now you have to describe which muscle are causing this movement. Which muscles are causing this movement? Closing of the mouth.
Opening, closing, temporary.
Closing means all muscles of mastication except pterygoid take part in the closing movement. What are the muscles of mastication? There are 4 muscles of mastication: masseter, medial pterygoid, lateral pterygoid, and temporalis. So closing movement is done by all the muscles of mastication except medial pterygoid. Closing হয়ে গেল. এবার ওপেনিং ইজ ডান বাই, যেটা বেঁচে গেল, কি বেঁচে গেল? ল্যাটারাল pterygoid plus the muscles which are attached here near the chin as well as near the hyoid bone. So what are the muscles from the chin to the hyoid muscles? Mylohyoid, suprahyoid muscles, that is digastric, posterior anterior digastric, plus geniohyoid plus mylohyoid. So for opening of the mouth, muscles concerned by muscle involved are lateral pterygoid plus geniohyoid, mylohyoid, and digastric. They are involved in the opening of the mouth, right? Now protraction. Which muscle cause protraction? ছবি দেখো বল, কোনটা সামনের দিক কোনটা পেছন দিক? সামনের দিক থেকে একটা মাসল আসে বললাম, protraction. Which muscle causes protraction? Medial and lateral pterygoid. Very good. Medial lateral pterygoid. protraction, and retraction. পেছন দিকে কোন মাসল টানছে? হ্যাঁ কি ছবি দেখে বল। Temporal is very good. Temporal is a very wide muscle. Temporal is wide muscle, the posterior fiber of the temporalis. It actually draws backwards, that is retraction. তাহলে posterior fiber of the temporalis causes retraction, right? As well as these muscles which was causing the depression, that is digastric muscles. They are also causing retraction, digastric as well as geniohyoid. They are also causing retraction. So these are the muscles causing retraction, right? So now এবার আমাকে বল, again I am going to the closing of mouth. Closing of mouth is done by which muscle? Closing of mouth is caused by which muscles? During closing of mouth, two movements are occurring. These two movements will occur simultaneously. First one is forward gliding movement as well as elevation. So to close the mouth, first there will be gliding movement as well as now in case of opening of the mouth, here you see first there will be gliding movement forward and as well as the muscles which will open the mouth. So which muscle cause forward gliding? Which muscle will cause forward gliding? That is lateral pterygoid. So lateral pterygoid, it is causing the forward gliding movement. This gliding movement is occurring at the upper compartment and lower compartment rotational movement, that is hinge movement. Lower compartment, that is done by which muscles? Lateral pterygoid, digastric, geniohyoid. So this is the opening of the mouth. Now you have to mention the axis. The axis is passing through the mandibular foramen, right? It occurs along the transverse axis. Now if you want to close the mouth, the things will reverse. There will be retraction and then elevation, right? So these are the closing. Now side to side movement, what will happen? The muscles of pterygoid muscles of one side will act alternately with the other side. Muscles of pterygoid of one side will act alternately with the other side. That will cause side to side movement, right? When side to side movement will occur at one side temporomandibular joint, there will be gliding movement, and another temporomandibular joint there will be rotational movement. একটাতে গ্লাইডিং, একটাতে রোটেশনাল, রাইট? যে দিকটাতে তো মানে গ্লাইডিং হচ্ছে সেটা হচ্ছে সামনের দিকে যাবে, আর রোটেশনালটা তার অপোজিটে হবে। There are two movements. One is gliding of one joint and rotational of the other joint. Now this rotational movement will occur at the vertical axis. That vertical axis will pass through the posterior part of the condyle. That vertical axis will pass through the posterior aspect of the condyle. Right? এতক্ষণ যে বকবক করলাম কিছু হলো? খুবই সোজা। এখানে কী কী নার্ভ থাকে? এখানে আর্টারি থাকে, দুটো আর্টারি, টার্মিনাল ব্রাঞ্চ, সুপারফিশিয়াল টেম্পোরাল, ম্যাক্সিলারি, দ্যাট ইজ দ্য আর্টারিয়াল সাপ্লাই। নার্ভ থাকে এখানে একদম পেছনে অরিকুলোটেম্পোরাল, আর একটা ম্যাসেটারিক নার্ভ, এই দুটো নার্ভ হয়ে গেল।
ক্লোজিং হচ্ছে সবগুলো এক্সিল মিডিয়াল টেরিগয়েড, ওপেনিং হচ্ছে ল্যাটারাল টেরিগয়েড, জিনিও হায়ার, মাইনো হায়ার আর ডাইগেস্টিভ, আর প্রোট্রুকশন মিডিয়াল প্লাস ল্যাটারাল টেরিগয়েড, আর রিট্রাকশন টেম্পোরালিস, জিনিও হায়ার আর ডাইগেস্টিভ।
So this in short the temporomandibular joint. Now come to the relations, which is to some extent difficult. Relations. What are the relations? Laterally it is the subcutaneous, so only skin and subcutaneous tissue. Anteriorly which lies anteriorly, that is lateral pterygoid, and one artery and nerve is coming, that is the Masseteric vessel cell nerve. They lies anteriorly. Posteriorly lies these two arteries, auriculotemporal and superficial temporal, and superficial temporal artery and auriculotemporal nerve posteriorly. Medially, what lies medially? Medially lies this ligament, Sphenomandibular ligament, auriculotemporal nerve, chorda tympani nerve. These are the nerves. Spine of the sphenoid. Spine of the sphenoid in relation to spine of the sphenoid, there are two important nerves. If you are given the base of the skull in osteology, this question will be asked. What are the important nerves? One lies laterally and one lies medially to the spine of the sphenoid. What are that nerves? Spine of the sphenoid এর medially কে থাকে, laterally কে থাকে? দুটো ইম্পর্টেন্ট নার্ভ থাকে।
Laterally auriculotemporal আর medially accessory ligaments.
Answer. Taste sensation ले जाता है। Which nerve? From anterior to thumb. बोलो। तो आके it joins the lingual nerve. It comes and joins the lingual nerve. Chorda tympani. Auriculotemporal and medially chorda tympani. Sphenomandibular ligament, auriculotemporal nerve. কি মানে রিলেশনস অফ দ্য জয়েন্ট, আমি ওটা বলছি রিলেশনস অফ দ্য জয়েন্টে both nerve will come. When I am talking about the relations of the joint, medially auriculotemporal will come and chorda tympani will come. And when I am talking in respect of spine of the sphenoid, because if spine of the sphenoid itself lies medially, so these two nerves also will come to the medial relations, as well as one important muscle, that is one muscle, that is stylopharyngeus muscles, they will lie medially, right? So these are the medial relations. Styloid process. Have you studied styloid process? Have you seen styloid process? Styloid process is attached to which bone? It is related to which bone? Styloid process? কোন বোনের পার্ট রে styloid process? Temporal. Very good. Styloid process. Sometimes styloid apparatus. Sometimes they come as a short note, styloid apparatus. So what you should write about the styloid apparatus? Bolo. If styloid process comes as a short note, what will you write? What are the muscles that attach to the styloid process? Stylohyoid, styloglossus, stylopharyngeus, ये तीनों muscles. Stylohyoid, hyoid means hind. Stylohyoid will come from the posterior aspect of the styloid process near its base. Stylopharyngeus from the medial aspect near the base. Styloglossus, glossus means tongue, कहाँ रहता है? Anteriorly. So from anterior aspect, styloglossus, right? From its tip, one ligament comes out, that is the stylohyoid ligament. ये सब लिखने से आपको पूरा मार्क्स मिल जाएगा. Stylohyoid ligament from the tip of the styloid process to the lesser corner of the hyoid bone. Stylopharyngeus from the medial aspect. Stylohyoid from the hind posterior aspect of the styloid process, and styloglossus from its tip and anterior surface. Now these three muscles, very important oral question, because these three muscles, stylopharyngeus, stylohyoid and styloglossus, they develop from three different sources. From three different sources. What are the different sources? Stylopharyngeus is developed from the ninth to the ये तो हो गया तो pharyngeal arch तो पढ़ा हो गया ताले stylopharyngeus developed from the third pharyngeal arch. What is the nerve of the third pharyngeal arch? Follow. You are talking among yourselves. What are the derivatives of the third pharyngeal arch muscles? Glossopharyngeal nerve is a nerve of which arch? Actually, this is the second class. I think you will capture it easily, but I think that it is as new as before.